Well, hello. We've got Colt here. He's a 5-year-old German Shepherd, Schützen champion, national champion, I believe.
National competitor.
All right. And his pet parent is Joe here. And unfortunately, Colt has experienced a degenerative condition of some muscles right here. And it's called a fibrosing myopathy. And really what's happening, to the best of our knowledge, is these muscles and the tendons associated with them are really just kind of scarring down, so they're contracting so that when he walks, when he lifts this leg up, it really turns in, and it's really severely affecting his performance. And so today, what we're going to do, as you can see, Colt is sedated. We're going to harvest a blood sample, and through a whole process here in the hospital, we're going to pull out the platelets. And so we're making platelet-rich plasma. So we're going to set that aside in the refrigerator. And then I'm going to pull a bone marrow aspirate from this bone here, the humerus. And we're going to go ahead and process that through much the same process and pull out the bone marrow stem cells. We're going to mix those in equal parts, and through an area that we've clipped and prepped and disinfected down here, I'm going to go ahead and introduce that combination into those muscles. And the few studies that have been done, the research has been really excellent in that those stem cells working with the platelets have decreased the inflammation, opened up those areas, decreased the scarring, and hopefully what we can slow, if not stop, this process and get him back to what he loves and what he's been born to do. So appreciate Joe, working with Joe here, and we're hoping for the best. Well, Colt is sedate, but not quite enough, so we just gave him a little booster dose of the sedation and waiting for that to hit. I just want to make sure this is not a stressful and a comfortable process for him. And so we'll wait for that to take effect. And then here in a couple minutes, we're going to be taking harvesting for his PRP. And really, it's quite a simple process, much like just giving a blood sample at your clinic. So we're just going to talk you down to where you are pretty sedate, kiddo. All right. Melissa here is opening the kits for a PRP collection. So again, it's just a straight blood sample, and we draw it up into a syringe that has an anticoagulant in it, because we don't want those platelets to activate and clot, because that's really the bread and butter of this portion of the treatment, is the platelets. Now, what's amazing about platelets here, for so many years we just thought their main job was to help us clot, in case you had a scratch or an abrasion. But over the last 10, 15, even 20 years, we've learned that platelets have amazing healing capabilities, mainly in the form of growth factors. What these growth factors can do is decrease inflammation, they can aid healing, they can call out to other parts of the body's healing capabilities and resources and draw them to the site. So again, really what we're doing is taking some of the best resources of the body, concentrating them, and then reintroducing them into the areas of injury. And treating the body is so much safer than a lot of our pharmaceuticals. And so we're really excited about this regenerative therapy. All right, and what you can see here is Colt is definitely sedated, and we're obtaining the blood sample from his left exterior jugular and rotating that, because the anticoagulant is in that syringe. And again, it's so important that we don't have platelets do what they were programmed to do, and that is clot. So we want to have those platelets separated and free, and as we concentrate them through this centrifugation process, we're looking for to increase the amount of platelets per cc of plasma by 5 or 6 fold and pull out really most of the red blood cells and a good portion of the white blood cells. We're really focusing on having the platelets be reintroduced into the tissue that's been damaged or is scarring and deploy at that point. So it's very important that we continue to gently rotate to make sure that this blood does not clot. Here we have Melissa starting on the process of the PRP, and she's taking that whole blood sample that is not clotted, and we're loading that into this concentrated device, and then we're going to go ahead and she's going to place that in this, it's a specially made centrifuge that we can plug in the certain RPMs because all blood components, platelets, red blood cells, white blood cells, have different weights, and so it's really, really important that we've got this dialed in so that the red blood cells go to the bottom because they're the heaviest. And after this centrifugation process, we're going to transfer the plasma, which is platelet rich. We're going to transfer that into a concentration device, and what that's going to do is basically decrease the amount of plasma by 5 or 6 fold, consequently increasing our platelet numbers by 5 or 6 fold per cc of plasma. Then we'll be able to draw that off, and that will be our treatment set, is the final platelet-rich plasma. I want to do this under aseptic conditions so that we really have no chance of contaminating the sample because we wouldn't want to pull good cells out, contaminate it, mainly with bacteria, and reintroduce it, causing an infection. So we got to follow certain guidelines in order to make sure that that does not happen. Here we're just marking the spot that I'm going to localize, put a full local anesthetic in there, and then begin our surgical prep. What I'm doing here is making sure I'm right on the edge of the bone, the humerus there, where I'm going to do my bone marrow aspirate, and making sure I numb that area up really well, because that's really, if there is discomfort, that's where it's going to be, is going through the outer layer of the bone known as the periosteum. We're all scrubbed in, and so just getting our ducks in a row for the bone marrow aspiration. And once we have everything set up, I'm just going to introduce a bone marrow aspirate device called a Jamshidi, and collect the bone marrow aspirate and then deliver that to Melissa in the lab so that she can go ahead and start the centrifugation separation process on that. There we go. Yes, this is we've already draped the area. What we're going to do is apply this sterile adhesive draping just to decrease, again, any chance that of a contamination. So the way this is going to pan out is like this, just like that, and have that stick there just like this. Okay. What we're doing here is just flashing the Jamshidi with heparin, so that really from the point that the platelets or the bone marrow leaves, the cells don't clot, because they'll want to clot too. So we're just going to basically flush that out like yay. All right. Put this back together. All right, so that it's ready to go. 35 there. All right, well, we're introducing the jam sheety into the humerus here, and once introduced, then we'll pull out the bone marrow. You can see the bone marrow coming into the syringe here. It's a very dark blood color, really. And of course, the bone marrow is the production center of really all the blood cells. And so it's very, very rich in red and white blood cells. And so we just gently remove the bone marrow. And that because we're looking to reintroduce all these cells as nice and alive and viable, we want to make sure that we handle with care. Okay, that's about it as far as our bone marrow collection. Taking out 30 cc's, which is an ounce, very close to an ounce. I will hand this off to for processing. Oh, Melissa. You can see here there's just a little bit of a incision that I needed to make, and we're going to put a suture in there, and that's it as far as the collection process. Right, what we're doing here is mixing the stem cell fraction and the PRP in equal amounts, and for Colt it's going to be 4 cc's of each, so we're going to have a total of 8 cc's that we're able to administer, and we're going to split that up between 3 different sites. So in this syringe is a 1-to-1 concentration of PRP and stem cells, and what I'm going to do, is go ahead and introduce it into this muscle belly. And we're going to make 3 separate injections. I'll put about 1/3 of this in each. And the really cool thing about stem cells, and this has been proven in a lot of studies, is that they will home. They will go to the area the body needs them the most. We're just giving Colt a jump start here in that we know exactly. I'm just going to put a little pressure right on that one. There we go. We're directing them right to the area of injury. Get 2 fingers. This one is right where it's balled up. That's this muscle. I'm going to place some a little bit more deeper in that semitendinosus. It's a much bigger muscle, so I've sequentially done less so that I could save some to get back in there deeper, and it's way down here. All right, they're in. All right. We're good. What we're going to do now is the sedation that we had administered to Colt, we can reverse it, and in 5 minutes he'll be walking out of here. Oh, look at you, bud. Oh, is that amazing?
There he is.
You did so good.
Hot.
You did so good, Colt. You're a star. You are a star. How about this way? Coast is clear. I think Colt's ready to head out. He's walking better, I think, than when he walked in. He's a good sport. All right, Joe. We will see you in 2 weeks.
See you in 2 weeks.
And hope and pray for the best. And he was great today.
Thank you very much, Doc. Again, thank you.
Hey, you're welcome.
I'll see you in 2 weeks.
Thanks.